Hi, my name is Namita Iso, and this is my checkoff. The 8 pre-procedural steps are: first, you're going to check on nursing orders, decision orders, and patient care plans. Next, you are going to gather all supplies and equipment. Then, you're going to wash your hands and maintain standard precautions. Then, you're going to put on PPE appropriately. You're going to introduce yourself to the patient. You're going to check 2 patient identifiers like their name and date of birth. Then, you're going to provide privacy by closing all curtains and shutting all doors. Next, you're going to educate the patient on the procedure. So today we have a patient, and he is a 19-year-old male who had his appendix removed yesterday. Good morning, Mr. Iso. My name is Namita Iso, and I'll be your nurse today. Can you please tell me your name and date of birth?
My name is Evan Iso. I was born on March 29, 2001.
And can I check this with your wristband? Looks good. So today, Mr. Iso, I will be doing an abdominal focused exam. Does that sound okay?
Yes.
Mr. Iso, do you have any pain?
No.
And I'm going to ask you a couple questions. I ask these questions to all of my patients. So who is the President of the United States?
Donald Trump.
And where are you right now?
The hospital.
What time of day is it?
Afternoon.
And why are you here?
To get my appendix removed.
Great. So I'm going to start the assessment. So I'm going to look at your eyes. If you can take off your glasses for me. So pupils are equal, round, reactive to light, and accommodate consensually. You can put your glasses back on. Next, we'll be checking the nose. If you could please tilt your head back, and I can see inside. So mucous membranes are pink and moist. Next, we'll be going on to the mouth. So if you could please say ah and stick out your tongue. And mucous membranes are pink and moist. Next, we'll be going on to lungs. So I'll be listening first anteriorly. So lungs are clear and there's no adventitious sounds like wheezes and rhonchi. And patient is statting at 99%. And do you have a cough?
No.
Patient has no cough. Next, I'll be checking the lungs posteriorly. So if you could please lean forward in your chair. So the lungs are clear posteriorly and there are no adventitious sounds. Next, we'll be going on to the heart. So heart is regular rate and rhythm and there are no murmurs. Next, I'll be doing a full abdominal assessment. So what we want to do is, in a clinical setting, the patient would be on the bed with his knees bent, arms to the side, and fully draped. But for video demonstrations, my patient's going to be sitting on the chair. So if you could please lean back. So upon inspection, we can see that the abdomen is soft and flat and symmetric. We can see that there are no hernias, no peristalsis, no ecchymosis, no lesions, no lacerations, and no visible masses. So first, what we want to do is we want to start off by auscultating first. We want to do this first because we don't want to falsify any normal bowel sounds. So we want to first start in the right lower quadrant. Then we're going to right upper quadrant. Then we are going to left upper quadrant. And then we're going to left lower quadrant. So patient has normal active bowel sounds in all 4 quadrants. Next, we'll be going on to palpation. We want to make sure we go from light palpation to deep palpation. So we're going to start off in the right lower quadrant, and this is where we would feel for the cecum and appendix. Then we would go to the right upper quadrant, and this is where we will feel for the liver and gallbladder. Then we will go to the left upper quadrant, and this is where you'll feel for the stomach and spleen. And then we'll go on to the left lower quadrant, and this is where you'll feel for the descending colon and the sigmoid colon. So from palpation, we can see that there is non-palpable organs. Next, we'll be going on to percussion. We want to make sure that we percuss in 2 areas in each quadrant. So once again, we're going to start in right lower, right upper, left lower, or left upper, and left lower. So there's a tympanic noise heard over all 4 quadrants. Mr. Iso, are you having a bowel movement every day?
Yes.
And has there been any change in your urine?
No.
And so Mr. Iso also doesn't have any catheters or Foleys. So next we'll be going on to the arms. So Mr. Iso has an IV in his right arm, and you can see at the IV site that there's no drainage, there's no redness, there's no erythema, and there's no edema, and there's no infiltration. So for the right arm, the capillary refill is less than 3 seconds. The radial pulse is 2+ and strong. The skin turgor is less than 3 seconds. Please do not let me push up. And then please do not let me push down. So he has good strength in his right arm. And then there's no edema and temperature is warm. Next we'll be going on to his left arm. So his left arm, the radial pulse is 2+ and strong. The turgor is less than 3 seconds. Do not let me push down. And then do not let me push up. So he has good strength. And there's no edema and temperature is warm and skin is smooth. Next we'll be going on to legs. So upon inspection of the legs, legs are symmetric, capillary refill is less than 3 seconds, there's no edema around the ankles, temperature is warm, and there's no edema. Next we'll be going on to the skin integrity. So posteriorly we could see that the skin integrity was intact. So in general we can see that there was no edema found anywhere, there was no, the temperature was warm everywhere, there was no wounds and no scars and no incisions. For his appendix removal, he had a 3-inch scar in the right lower quadrant, and the wound is healing up very nicely. There is no drainage, no erythema, and no edema, and there's no signs of infection, and it's in the normal healing process. And there's no other devices that Mr. Iso is in. There is no other drains and no other tubes, and everything else looks great. And so, Mr. Iso, I'm going to be lowering your bed back down, and if you have any questions, please let me know, all right? And thank you for your patience.
Thank you.
So the 6 post-procedural steps are: first, you're going to return the bed to the lowest and locked position. You're going to bring the 2 side railings up, and then you're going to make sure the call light is within reach. Next, you're going to ask the patient if they have any additional questions and let them know of your expected return. Then you are going to dispose of all PPE properly. Then you're going to clean all equipment that was in contact with the patient. Then you're going to wash your hands. Then you're going to document date, time, assessment, procedure, and the patient's response. Thank you.